If you are preparing for AMC Clinicals, then you must know this that in order to pass that exam, you have to be very strong in your physical examination. If you look at the clinical handbook, AMC handbook, you'll find out that about 25% of the cases in that handbook are for physical examination. And if we follow the same ratio, let's assume 25% of the cases in your real exam are physical examination, which means 3 or 4 stations in your exam are going to be physical examination ones. And if you need 9 stations to pass, and if you're getting 4 stations of physical examination, then I think that becomes the most important domain for you in order to pass AMC Clinical. My name is Andrew. I have done AMC, MCQ and Clinical, and in this video I'm going to talk about physical examination and how important are them to pass your AMC Clinicals. Now, the first question is what to expect in your physical examination. See, a core difference between PLAB and AMC is that in your PLAB exams, you will be asked simply do an abdominal examination, do a cardiovascular examination. But if you look at the AMC clinical handbook, which is a representation of your AMC exam, a patient will present to you with a symptom, and then you have to decide what examinations are you going to do and in what order are you going to do those examinations. For example, let's say a patient comes with an epigastric pain. Now, in that case, the relevant examinations are going to be both cardiovascular and abdominal. Now, it's your job as a doctor to decide what all different system examination are you going to do in this patient. Now, if the second point that I want to make is you have to decide to what extent are you going to do that examination. For example, the same epigastric pain patient comes with shortness of breath and sweating. Now, cardiovascular examination becomes your core examination and abdominal examination becomes your secondary examination. And so you'll spend more time on your cardiovascular and then 30 to 40 seconds quickly doing abdominal examination and looking for any findings in your abdominal examination. Now, if I change the entire scenario and if I say that there is an epigastric pain, there is no chest pain, there is no sweating, there is no dizziness, there is no shortness of breath, but with the epigastric pain, the patient is a chronic alcoholic, is a known case of gallstones, and so now since your top differential is going to be pancreatitis, so now your core examination will be abdominal examination and then your secondary examination will become cardiovascular examination. My point is, in your AMC exams, you will be given a symptom and then you will be expected to decide what all examinations are you going to do. Secondly, you will be expected to decide in what order are you going to do those examinations, and thirdly, you will be expected to know to what extent are you going to do this examination and to what extent are you going to do the other examination. And so this is what makes AMC Clinical more challenging. Next, how to prepare for physical examination. There is one book, Telio Corner. You definitely have to read that book. If your exam is in the next 2 months, then you should just follow your coaching institutes, whatever you're following. But if you are an intern, if you are a final prof student, if your exam is in 6 months or 5 months, in that case, you should definitely make your own notes, read that book, because first of all, it's a readable book. It's not too extensive, it's not too elaborate, and it is very easy to understand. Next is accuracy. I had a comment and somebody was asking me that how do they judge you based on your accuracy. And so the simple answer is, with an example, in your PLAB 2, there was a case of knee examination in which the examiner would sit on the chair the entire time, and only once you were doing the anterior draw test, the examiner would get up and would come to you and see where are you putting your thumbs. The correct way is to put your thumbs just below the knee on the tibial tuberosity, and so the examiner would come and check if you're placing your thumbs, and that is one example to see how specific they are in terms of accuracy. Now, if you read Telio Corner, you will understand on your own which point is for the accuracy. For example, if Telio Corner is emphasizing on a point, let's say cardiovascular, if Telio Corner is emphasizing twice or thrice that you need to check the apex beat with the palm of your hand, and you need to check the palpable thrills with the heel of your hand, if he's mentioning it twice or thrice, then there's a high chance then that point is going to be taken up as an accuracy point in your exam. And so I cannot tell you in one video which all points are for the accuracy. You'll have to read the book, you'll have to understand, and once you are reading, you will yourself understand that okay, this point is being emphasized a lot, and it's possible that in my exam, the examiner will come and will judge if I'm doing it this way. Next is differential diagnosis. In your physical examination cases, you will also be asked about differential diagnosis, and so a lot of candidates find it difficult to come up with differential diagnosis in your physical examination. How I would recommend is, don't worry about findings of physical examination if you want to talk about differentials. Just think of the clinical symptom. For example, let's say the same patient has come with epigastric pain. So now, after you've done your first task and after you're going to your second task, which is talk about differential diagnosis, don't worry about the exam findings, don't worry about what was positive and what was not. Just think of epigastric pain and tell whatever differentials comes into your mind. So for epigastric pain, you'll say pancreatitis, you'll say hepatitis, you'll say peptic ulcer, you'll say gastritis, and then come to the cardiovascular, you'll say pericarditis, acute coronary syndrome, and then lung problems, let's say pneumonia or trauma and things like that. So don't worry about the exam, just think of the symptom, just think of the question, and then come up with whatever differentials you can think of for that specific symptom.